Hi, my name is Nate Gach. I'm the Director of Innovation here at Independence Blue Cross. I'm joined today by Senior Vice President and Chief Information Officer Mike Vennera. Hi, Mike. Thanks for
Hey
being
Nate,
with us today.
how's it going?
Excellent. So I've got a few questions here for our friends at the Hackathon. My first one is, how did you find yourself in healthcare in the first place?
Yeah, so I would like to say that it was a purposeful decision, but to be honest, it was a kind of a historical accident. I had left grad school after a couple of years, searching around for something to do. Knew someone at Independence Blue Cross. They suggested it was a great company to take a look at. Ultimately, got in the door, and then 23 years later, I'm still here. But it turned out to be a great accident. It's been a great company. Healthcare is a really exciting industry to be in. Just a lot of action, a lot of innovation. And, oftentimes when I talk to people externally, particularly young people, kind of think about what to do in their career, and I talk about working at a health insurer, it doesn't come across as maybe the most interesting or sexy job, but it actually is, right? If you're interested in healthcare, being at a health insurer is a great place to be. It really is at the intersection of a lot of different parts of a really complex healthcare ecosystem, which I think last time I checked is approaching 20% of GDP. So it's a huge, exciting, interesting industry, and being at a health insurer is being right at the center of it.
So, Mike, what are your thoughts on what makes for a good technology-based healthcare solution?
Yeah, well, I think what's really good is that it's a good healthcare solution, right? Technology is an enabler in healthcare. I've seen a lot of things or applications that aren't really great, where people are, they have a hammer and they want to find a nail, right? Or they've got the latest, sexiest technology that they want to apply to a healthcare problem. And that really doesn't work. You really need a good healthcare solution enabled by technology. And what I mean by that is just something that actually addresses like a real need within the healthcare system, has a way of working within the sometimes convoluted way that our healthcare system works, and actually has someone that's willing to pay for it, which is often, I think, one of the areas that you see a lot of healthcare solutions, particularly those that are, maybe more technologists kind of come up with, don't understand how healthcare financing works. And, there's a solution that sounds good, but no one's willing to pay for it, is not going to get any market traction.
So, Mike, how does Independence make use of the data that we have on hand?
So one of the good things I mentioned, how healthcare, particularly being a health insurer, is you're at such an intersection of the healthcare ecosystem, and that really manifests itself in data, right? So if you go to your primary care doc, right, that doc, maybe in their EMR system has a view of you and your healthcare. But then if you see a specialist, particularly if that specialist isn't affiliated with your primary care doc, that specialist will have a view of your healthcare, which maybe is not the same view as your primary care doc happens. Then when you go to the dentist, right, they've got another view, right? It's really only the payer that brings all of the data together, right? Since we're essentially, paying for everything, we also have all of the data. And that's critical because it enables us to do a lot of different things. So the way we use it are primarily really trying to, drive our mission, right? Which is improving the health and welfare of the communities we serve and of our members. So examples of how we use data would be, predicting someone who is likely to be hospitalized and getting that information to that member's primary care doc so that the primary care doc can have a conversation with the member. Or maybe, identifying someone that needs a call from one of our care management nurses, right? Because maybe they haven't refilled their medication, or it looks like, they're starting to maybe progress, in the wrong direction in terms of sort of a chronic disease. So we want to be able to intervene early to keep that member out of the hospital and keep them well.
Do you have any thoughts on how data can be used to best drive innovation?
Yeah, well, I mean, data tells you a lot of things, right? And I think that's one of the some of the magic, if you will, around data. So you will have ideas around the way things that work, and particularly if you've been in the industry a while, like me, you have a lot of intuition, right, about the way the industry works and the way things work. And a lot of times that intuition's right? That's why, experience is valuable, but a lot of times it's not. And a lot of times there are things that no one in the industry sees, right? And those are things that data often surfaces, right? Connections between different aspects of the healthcare ecosystem that you just simply would not otherwise, think about, right? And data can help surface those. And then when you find those sort of unique connections, right, that no one had thought about before, right, well, then that's an avenue for innovation, right? So if you see, I'm going to make this up, right? If you see a connection between, let's say, a certain disease, certain two disease conditions or disease states, right? That isn't, hasn't otherwise been commented on. Well, maybe there's an avenue of innovation there, right, to kind of tackle that. Or if you see certain socioeconomic conditions or statuses tied to, other, again, certain, diseases or health outcomes, how can you innovate? It gives you a space to, or target, if you will, for innovation.
What kinds of wearables or devices do you find are most valuable?
So wearables are a really interesting space right now because it's an area that's where there's a lot of innovation going on, and it seems pretty early, right, in the development of wearables. And there's a couple of interesting things I think from a healthcare space. So one, a lot of them are direct to consumer, and I think that's actually where the most interesting wearables are. I think there are certainly some more clinically oriented wearables, but I think the real interesting action is on the direct to consumer. Think of the Apple Watch and its kin, right? And there's really a couple of reasons. So by going direct to consumer, they're kind of building a trust in end consumers, right? Because the consumers decided to buy that product themselves versus having it given to them or prescribed to them by something. But it also reminds me of, if you've ever read Clayton Christensen and his work on disruptive innovation, he gives the example of the transistor radio. So he kind of harkens back to the 1950s and talks about, the cheap Japanese transistor radio showing up and it being really crappy, right? So the behemoths of the audio industry at the time, like RCA, really paid no attention to it because it was really cheap, low-end product, not that good, so why pay attention to it? But over the years, the Japanese products got better and better and better till they sort of consumed the business that RCA was in. And I think about something like that today might be playing out in healthcare, right? You think about what Apple introduced in the last version of the Apple Watch when they first introduced their EKG capability. It was, came with all the warnings like this isn't a real clinical test, goes to your provider. I know when we had, a couple clinicians take a look at it, they thought it was, not very reliable, had a lot of false alarms. But that reminds me of that transistor radio, right? It is going to get better over time, and it's on millions of people's wrists. So what happens, in a couple of years when that does get to, the same quality as a hospital-based, EKG, and then you can run it constantly, right? And you can kind of, get all those metrics in. So I don't know where it's all going to go, but I really think it's a really interesting space. And I think that combination of getting it on the wrists of millions of people with technology that is only going to improve over time is a powerful combination.
Where do you see the universe of sensors and device-based markets heading into the future?
Yeah, I mean, I see it really becoming more I do think there's a question around data and security that people need to sort of get comfortable with. But I think people will get there. They seem pretty confident putting a lot of their data in social media, right? Solutions today. But I think where I see this going is particularly for chronic diseases. I think is where you'll see it earliest, right? Chronic diseases, elder care, kind of aging in place. This kind of smart home solution to help take care of that individual and kind of monitor their environment. In fact, Independence, our subsidiary or our joint venture Quill that we have with Comcast, is actually working on a solution around this space right now, which is pretty exciting. So it's an area that we're bullish on. But I think beyond that, we could get up to a point where you're constantly monitored, right? Even if you're healthy, to get to this latest variation in blood pressure, blood oxygen level, right? Heart rate. Imagine that being continuously monitored. And if you could get to the point of getting past all of the false alarms, which I think is also a real problem, you could get to this point of really detecting things very early. But I think that's where we're going with this type of continuous monitoring, in place, probably starting again with the sickest and the oldest, but really moving over time, into the healthy.
So what do you feel is the future of data in healthcare?
Well, there's a lot of interesting things going on with data. There's a lot of innovation, going on out there in the space. And I think one of the most important things that's actually happening right now is actually coming out of the federal government, which, may surprise some people. But there was a mandate put in place by the federal government over the last year that applies really to Medicare business. But it's something called the CMS interoperability rule. And really what it boils down to in a nutshell, and it's certainly more complex than this, but the simple version of it is entities like Independence that have data on a member, that member will then be able to go. So if you're a Medicare member, you'll be able to download a healthcare app off of the App Store, right? Not affiliated with Independence or any other insurer. And if you want to pull your healthcare data into that, then Independence needs to provide an API out, a public API that this vendor, once the member authorizes it, and that has to be done in a secure fashion, will be required to send our data to that vendor. So you can imagine that's going to open up a whole new, space of healthcare innovation, right? Because data has been such an important asset for health insurers and really any healthcare entity that we've all been a little bit like this with it. But this is really going to open up the space so that you can get third-party applications that can say, okay, I want, the data from you. You're an Independence member this year. You were an Aetna member last year. You went to, Jefferson, for your care. I want all three of those entities to, send data to, the Acme Healthcare app that I, the member, have decided I want to use. So that's going to really open up I think a lot of different avenues. A lot positive. I think there'll be some negative, right, too, just with data being out there. But that's certainly, I think, a space where there's going to be a lot of innovation.
So, Mike, before we wrap for the day, do you have any advice for the hackathon teams this weekend?
Sure. I would do a couple things. So one, I would think about your own experience in healthcare. All of us are healthcare consumers, whether directly, right, our own care or a loved one. So think about your experience and where you've had pain points in the system, and think about the solution you would want, that you would want to be there and that you would actually use. And just as importantly, because I know we're talking about data as well in this hackathon, a solution that you would trust, right? If it's going to solve a problem that you've had, if you're going to trust it and it's something you would use, I think you'll be well on your way.
Awesome. Thanks for your time today.
All right. Thank you, Nate.
Thanks all for your time today, and best of luck this weekend. We can't wait to see what the hackathon has in store.